My name is Michael Battelle, and I'm the president and founder of the Fatty Liver Alliance. Today, I want to welcome Dr. Stasia Hachianakis, who is a pediatric endocrinologist and the medical director of CHEO's Center for Healthy Active Living. She's an associate professor of pediatrics at the University of Ottawa and has been an active member of the Department of Pediatrics at CHEO in the Division of Endocrinology since November 2001. Sorry. Childhood obesity and type 2 diabetes are on the rise, and maybe even the incidence has risen higher since the pandemic. And I hope we can talk about that today too. Doctor, what is the current situation with NAFLD and NASH in children from your perspective as an endocrinologist?
Yeah, thank you so much for the invite, Michael. It's lovely to be here to chat with you today. Um, so I see children in my practice who are living with obesity or living at a higher body weight or higher BMI, and probably about 60% of the young people that I see have either clinical evidence of fatty infiltration of the liver just based on ultrasound findings or mild elevation of liver enzymes. So very common coexisting condition with those who have a higher body mass index, and kids who are teens are slightly more vulnerable because at that time in our life our body becomes a bit more resistant to insulin, and that can exacerbate or increase the demand on the liver in terms of the work that has to do to metabolize our body fats. So about 60% of kids, the thing about NAFLD or fatty infiltration of the liver is it's silent. So it doesn't typically cause symptoms. So the only way to really know that a young person might have NAFLD is to screen for it. And I think that's an important message. And then we know that it is a highly heritable condition, just like body shape and size is is a is part of our genetic makeup, is sort of determined by our genetics. Some of us who have a higher body weight will also be more vulnerable to developing fatty liver disease, and you're more likely to see it in youth who also have a family history of fatty liver disease or also have a family history of other forms of insulin resistance like type 2 diabetes, dyslipidemia, in women, polycystic ovarian syndrome. So they tend to cluster. So we have sort of more metabolically at risk youth and more metabolically at risk families where these findings might cluster.
So I was wondering, okay, so let's say I'm in a family that I know there's multiple people, even multi-generational maybe, problems
Yes.
with obesity and type 2 diabetes. So do we have this discussion with the pediatrician really early on, even before, maybe even before the onset of obesity or excess weight?
Oh, yes, because we know there are a lot of limitations. So the way we measure obesity is not always particularly accurate. So traditionally, we've defined obesity based on body size using body mass index, but we know that there are a lot of limitations with that measure, in that you might overestimate health risk in some individuals if you're simply looking at body mass index, and you're likely to underestimate health risk in other individuals. So to me, features of insulin resistance run in families, and you won't be able to tell whether it's present or not if you're just looking at body mass index, which is the traditional way to define obesity. So we would recommend that you begin to think about screening children for features of insulin resistance if they have a first or second degree relative with type 2 diabetes, NAFLD, dyslipidemia, and you can start screening as early as age 10 or earlier if puberty starts earlier. And
What,
so I would, yeah.
oh, sorry.
Mhm.
What is this what the GGT 2-hour test is, or is there something else?
Oh, right. That's a great question. So we used to put young people through the 2-hour OGTT to screen for blood sugar abnormalities, but it is a very burdensome test. They don't like the drink. They have to sit in the lab for 2 hours. So we've moved away from that as a screening test for blood sugar difficulties, and we're doing now um, a fasting or a random blood sugar and a hemoglobin A1C, which gives us an idea of what the average blood sugars have been over the last 3 to 4 months. So we've sort of moved away from the 2-hour OGTT and really are just doing a blood sugar, either fasting or random, and a hemoglobin A1C.
Okay, well, that was good to know. Thank you. So I was trying to picture a family that's in this situation and what they would do. So, we said that if somebody feels that they have that family risk, that they should check. Let's say they haven't done that and they have children, teenagers maybe even, that are overweight or even obese. So what should they talk to their doctor about?
Yeah, so I think you can go to the person that I would expect to kind of take the lead on this for this family would be their family doctor. It'd be nice if, I mean, ideally, the family doctor is seeing all family members. That's the beauty of family medicine. I think sort of saying, we know that health exists across a wide range of body shapes and sizes. At the same time, we know that uh, certain health risks can run in families and may be more likely if you have a higher body mass index. We just want to make sure that your body's healthy. And given that your mom or your dad or your grandpa is affected, we'd just like to do some blood work to make sure that this young person is okay for now, and then uh, continue to recheck every two, if things are normal, you can sort of recheck every 2 to 3 years to make sure that they stay normal. But I would, if I would take my young person to my family doctor and say, look, doctor, I know I have this family history. I'm worried. I want to be proactive with my son or daughter. Would you mind if we do some screening blood work to look at his or her metabolic health?
Okay, no, that's very helpful. Now, I've heard recently, now obviously we've been and are still in a pandemic, but there's another epidemic going on, right? And so would you go as far as to say in pediatrics that it's an epidemic right now with regard to weight, obesity, and NAFLD maybe?
Well, so I think the rates of obesity, like based on body mass index, in terms of prevalence of obesity, at least in Canada, did start to plateau a little bit in the late 2000s, after 2012. I think that though the 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 degree of metabolic health issues that we're uncovering are certainly increasing. And it's hard to know if we're just doing a better job screening and identifying kids who are at risk, or whether the numbers are increasing. Certainly, when you think about metabolic health conditions, I think about 4 things that can exacerbate your risk for having a metabolic health condition. One is, the way we feed our body throughout the day. The second is the way we move our body throughout the day. The third is how well we sleep at night, and the fourth is how well we manage stress. And so whether it's physical stress or emotional stress, it can definitely exacerbate metabolic health issues. And I think if you throw in the pandemic over the last 2.5 years, it's really impacted all 4 of those things for many people. So it's taken away a lot of things that maybe were our outlets, or sort of allowed us to manage stress a little better, our sources of pleasure and joy. And maybe some of us, um, we might have been more vulnerable over this period of time for things like emotional eating or boredom eating, or access to food was compromised because of what was going on in our social situation, job losses, or less job security. So our food environment may have changed. Our activity opportunities certainly decreased. And there was definitely stress related to the pandemic. And so what I've seen anecdotally is, just as kids are coming back into clinic for follow-up, there has been a noticeable change in body weight, and also some changes in metabolic health that are concerning, that we're trying to sort of get back on track. But their ability to manage their health was compromised by what was happening over the last 2.5 years, both for parents and for kids. So I think sort of helping to get back on track over the next couple of years will be important. Yeah.
Well,
And then
that's
I think also there were people missing doctor's appointments as well, right? So that regular screening. So we may even see more because I think people even getting to doctor's appointments and getting their regular screening done wasn't really happening in the same way over the last 2.5 years. So
no, that's why we want to talk about this
yeah,
topic today and as many times as we have to in the future to try to save some lives here.